Hi, this is Dr. Brenda Morthy, and today we're going to talk about how to prepare for your breast surgery. At the Comprehensive Breast Center, we're privileged to take the journey with you. And today I'd like to prepare you for what to expect with your breast surgery. So firstly, planning for your breast surgery includes making sure you get COVID testing. So during the time of the pandemic, we do require that before you come into an operating room that you're COVID negative. So I've listed all the facilities that I go to and where you should receive those instructions from. So if you're at Honor Health, Piper, or Shea, or Banner Boswell, the facility will reach you directly in order to coordinate testing with you. If you're coming to Honor Health Deer Valley, my surgery scheduler will instruct you. A lot of patients have questions about family members and where they should wait. I would suggest that you reach out to the facility and clarify those questions. So 5 days prior to surgery, you'll want to stop taking any aspirin or blood thinners, fish oils, omega supplements, garlic supplements, vitamin E or herbal remedies. And the reason is that all of these things can increase the risk of bleeding. So again, just for clarification and to reinforce that we do not want you taking any aspirin products 5 days before. That includes Advil, Motrin, or ibuprofen. If you do have a headache prior, you can certainly take Tylenol until midnight before your surgery. The night before your surgery, you also do not want to eat or drink anything after midnight. I will have already told you what medications you should take the morning of your surgery, and that is to be with a very small sip of water. If you're diabetic, the night before surgery, you can take your normal diabetic medications. If you take insulin, you can take half of the dose that you normally take, but in the morning of surgery, we don't want you taking any of your diabetic medications or your insulin. If you take any blood thinners like Coumadin, Eliquis, Plavix, you'll want to stop depend on these prescribed times. So if you're taking Coumadin, you'll stop 7 days prior to surgery, Eliquis is 2 days prior, and Plavix is 5 days prior. I also recommend that you discuss this with the doctor who prescribes this for you and make sure they know that you will be stopping. Before you come to the hospital, please make sure that you remove all of your earrings, nose rings, tongue rings, finger rings, any abdominal, umbilical rings, just because these rings can interfere with the surgical bovie and increase the risk of burning. So we definitely don't want that. Please don't use any makeup the morning of, no nail polish, no contacts, just bring your glasses if you need to. You will need to have somebody to drive you home. So let's talk about what a lumpectomy is. A lumpectomy is where you're taking out tissue from the breast. If you feel a lump and both of us feel that lump, then that's easy. We know exactly where it's located, and so I can take that out while you're asleep. Most women won't have anything that they can feel, and they would have perhaps gone to a radiology facility and had a biopsy and had a clip put in. But the reality is you don't know the exact location of that abnormality to be removed. So that's why prior to surgery, I will schedule you also to have either a radioactive seed placed right next to the clip or a wire. So both of these do the very same thing. They help me and guide me to the area that needs to be removed. And again, the biopsy clips that are placed during the biopsy really can't be felt or seen, and that's why I need some extra help. So a lot of times I'll use the radioactive seeds just because they can be done the day before surgery and we can get started earlier, but sometimes a wire is also used. So what I've done for your ease is to highlight the facility and then where those wire or seeds will be placed. So if you go to Honor Health, Deer Valley, or the Surgery Center, you'll go to the Breast Health and Research Center. If you are having your surgery at Piper or Shea, you'll go to Scottsdale Medical Imaging. If you're having your surgery at Banner Boswell, you'll go to Lakes Medical Imaging. So the procedure of having a wire or radioactive seed placed is very similar to a needle biopsy, except for nothing is being removed. The procedure is done with local anesthetic. You are awake during the procedure. They numb you up, and then you use the location of the clip to actually help guide the wire, the seed placement. Wires can only be placed the day of surgery, whereas radioactive seeds can be placed the day before, even several days prior to surgery. So this is an example of what a wire looks like. Part of it sticks out, and part of it goes right next to where the clip is located. Again, we use this when we cannot feel the abnormality to be removed. The clip at the time of the biopsy that's placed is not something that we can use because it can't be felt. So the wires are placed to guide the surgeon to the correct area. The wire, as well as the clip and the abnormalities, all removed during surgery. And again, the wires are placed the day of surgery. Radioactive seeds are just a different way of doing that same thing. Again, it's placed when we cannot feel the abnormality that we need to remove. Again, the clip that is placed at the time of the biopsy cannot be felt. So the radioactive seed is placed to guide me as the surgeon to the correct area. The radioactive seed, along with the clip and the abnormalities, all removed at the time of surgery. The advantage of the seed is it can be placed several days prior to surgery, and that can help allow you to have an earlier in the day surgery. Incisions are generally about 2 inches in length. All are closed with dissolvable sutures. Surgical time is approximately 1 hour, and this is general anesthetic. You'll then go to the recovery room for about 45 minutes. Your surgical site will be closely monitored, and you'll stay here until you are ready to go home. A lumpectomy is a day surgery, which means you go home the same day. We ask you to not do any heavy lifting, and you can return to work in 2 days as long as your job does not require heavy lifting. We ask you not to do any driving for the first 24 hours after surgery, and after that is determined by how long you're taking the narcotic pain medications. So after surgery, you will have a breast binder on. It velcros down the front. It's for compression. Some people will also have an extra ACE wrap on top of that. Regardless of what you have, you will keep both of these on for the first 24 hours. After 24 hours, you'll take that off. So if you have an ACE wrap, you'll take that off as well as the binder. You will shower and then transition to a regular sports bra. What you'll see is a lot of gauze over the incision. The incisions will have glue on them, and it will just flake off over time. Please don't pull on the glue. If your surgery is along with a plastic surgeon, they may have different instructions and dressings, so you will get instructions from them, and that will supersede mine. You will also leave the hospital with a post-op appointment, which is generally about 2 weeks after surgery. Your pathology report is generally discussed with you then. If we do get it earlier than that, sometimes we get it within 5 days or at 5 days, and Marcia, who's my physician's assistant, will reach out to you with your report if we get it earlier. You can shower after the first 24 hours. Please avoid soaking the incisions and use mild soap. Swelling around the area is not abnormal at all, but if there's a lot of it or there's a lot of bruising that takes up more than half of the breast, then please feel free to call the office. Again, infection is not a very common event, but things you want to watch out for include redness, discharge, hard or rapid swelling, or fever over 101.5 for over 24 hours. Most people will only need extra strength Tylenol after surgery. I generally will call in some tramadol, which is a narcotic pain medication that you can use in case you need something stronger for the first couple of days. If you do take this, you are not allowed to drive if you're taking these medications. Also, make sure you take it with food, and you can avoid constipation by taking an over-the-counter stool softener starting the day of surgery, and you can stop after you're done taking the narcotic pain medications. Make sure you drink lots of water and walk a lot, since both of these will stimulate the gut. For 2 weeks after surgery, we recommend you do no heavy lifting after 10 pounds, no swimming or soaking in a tub. You can resume driving if you're not taking any of the narcotic pain medications, and have full range of motion with your arms. The first 24 hours after surgery, your diet should be bland. It is normal to have nausea for the first 24 hours from anesthesia. Please call our office if it lasts longer than 48 hours. Make sure you drink plenty of fluids. You can resume all your medications unless you're on aspirin, in which case we recommend you wait for 48 hours. If you're on a blood thinner, I'll give you instructions on when you can start. After your shower in 24 hours, you can transition to a supportive bra with no underwire. I recommend you wear it all the time, even to bed, for the first couple of weeks. Underwire is okay after 2 weeks as long as there's no pressure on the incision. So again, let's recap the reasons to call our office, and that would be if there was any fever over 101.5, if you have any nausea or vomiting that lasts over 48 hours, if there's any drainage or spreading redness of the incision. There's some things that are incredibly rare, but we do ask you just go to the emergency room, and that's if you have severe chest pain or shortness of breath. Please note, after office hours, we always have a physician on call, so please use our direct number 602-374-3440 to reach the doctor on call. Some of you will be texting during the work days to my scheduler. Please note that none of the texting services are attended to after hours, and this should not be used. If you have any other questions, including FMLA paperwork, you can email them to my scheduler, and I've listed her email address here. Otherwise, I will see you soon, and it is my privilege and honor to take care of you. Thank you.